Hi there, my name is Megan Warfield Kimball, and today I'm going to take you through my evidence-based practice project regarding research on a topic that's pretty near and dear to me. I work for a company called Home Healthcare Inc. So obviously the majority of my clients are home care clients. And one of the topics that is pretty important in home care is fall risk. So my topic is fall risk intervention for community dwelling older adults. And my mentor for this project was Becca Engberg. Okay, so to give you all a little bit of background on why I chose this topic of fall risk in the community, is being an occupational therapist in the home care setting. You know, a lot of the clients I see are typically coming back home. They've either recently had a hospital stay or that hospital stay and a transitional care unit stay for rehabilitation. They've often had a recent illness or injury, and then sometimes that's even combined with chronic illness, other chronic pain, or other issues they have that really makes them a high risk for falls coming home. Um, Fall risk assessment and intervention is a major concern for us in home care. It's addressed daily by all disciplines involved, typically nursing, physical therapy, occupational therapy, are looking at kind of those fall risk factors, and we have to record that in our notes as well. So it's really a big issue we deal with in home care. So that's really one of the main reasons that this project came into being for me, is to really find out, are we doing everything we can be for interventions for fall risk at home, and kind of what is the literature out there on that. So some of the fall rates and statistics I just wanted to add in here. According to Mayo Clinic, people 65 and older are at a higher risk for falls due to physical and health related changes. So this is a huge statistic, not even including chronic illness or injury or whatever they've gone through with the hospital. Just being 65 and older, due to those changes, they're at a higher fall risk. The Centers for Disease Control also reports that 1 in 4 older Americans fall each year, and they cite falls as the #1 cause of injuries and death among older Americans. So there's really a huge need here to be addressing fall risk and doing everything we can to prevent falls. Also, I just wanted to kind of go over the fall risk factors that have been identified in kind of all of the general websites, research knowledge base on falls. Um, a couple that I looked at included the National Council on Aging, Mayo Clinic, Minnesota Falls Prevention, and the National Safety Council. And the 4 main identified factors include vision, medication, balance and gait, and environment. So those 4 factors really can affect an individual's risk of falling. Okay, so as for my evidence-based practice question, I went through a lot of trials of what am I really looking for in the research here. I knew that I really wanted to look at fall risk and what interventions were best, but then I kind of struggled with what population am I looking at? I work with a variety of ages of people. Typically, they're, elderly, 65 plus. So do I look at just that population? I want to make sure they're living at home. So, how do I address that in my literature search? So I kind of had to go through a few of the hoops just to figure out what I wanted to specifically ask. So what I ended up with here was, what interventions are most effective in reducing fall risk in community dwelling older adults? So for the population, the main keyword I came up with here was older adults. That's what seemed to be the best within the literature searches to get me what I needed for that specific population I was looking for 65 plus. Some of the other keywords along with that I found were elderly, aging population, 65 plus, geriatric, older people, and frail elderly or frail older adults. Um, then for the intervention, I knew I wanted to look at anything that was reducing fall risk. So that was the big intervention there. And then for kind of some of the other keywords, I looked at preventing falls, environmental adaptations, exercise program, safety, fall prevention, and fall prevention program. Then for the comparison group, There wasn't anything specific I wanted to compare it to. So the best way to kind of look at it was I wanted to compare the different intervention techniques. So one to the other, and if they didn't do so, that was okay. Just throughout the literature, I was able to figure out which were the best interventions. So lastly, for the outcome, the main outcome I wanted to see was reduced falls. That other keywords that went along with that were kind of increased quality of life, reduced hospitalization, client and caregiver satisfaction, reduced fear of falling, improved safety, reduced or decreased injury, reduce fall risk, improve function at home, and decrease fear of falling. So those were the major things I was looking at with the outcomes there. Okay, so now I'll talk about my level 1 search. So this was the first search I did regarding my topic, and it was actually a really nice initiation to reviewing all the literature out there because I was initially only looking at systematic reviews and meta-analyses. So I didn't have to use very many keywords. I didn't really have to think through as much about my thoughts. I was able to get some results and go through those and find what I was looking for. So the first search I did was of the Cochrane Library, and initially I used too many keywords and I ended up with no options with my search. So eventually I settled on just using the keywords falls and community. And that ended up giving me 27 results, which was pretty manageable to look through, and 4 of those were relevant. My second search was on OT Seeker, and the keywords that I used there were systematic review, community, and falls. So the nice thing about that was just using the word systematic review within my search really limited the search options. And with the Cochrane Library, that was a little bit different because when you're searching that specific database, you're really only looking for, and they only deal with systematic reviews. So I didn't even have to use that as a keyword. So for OT Seeker, though, I came up with 22 articles, and then 2 of those specifically matched my evidence-based practice question. So my third search was the AOTA, the American Occupational Therapy Association, and I looked at their journal. And then the keywords I used there were systematic review or meta-analysis and community and falls. So I got 2 results there, and both of those 2 results were relevant. So for my level 2 search, it was a little bit more difficult because I was looking at just single studies and not those systematic reviews or meta-analyses. But I first used OT search, and this was where I really had to get a little bit more creative and think through kind of my keywords, my limiters, what I was doing to really get the articles I needed to. So I ended up using the main keywords of occupational therapy, falls, intervention, older adults, and community dwelling. Combinations of those keywords as well as looking at different limiting factors, different years, different types, only looking at, you can limit by age groups as well within one of the limiter sections. So within those combinations, I found anywhere from 578 within my search results to just 1 result. So what I found from that was only 2 relevant results. The next one I looked at was PubMed, and that I also used some of the different varying limiters as I went along, years, things like that, along with the same keywords. So occupational therapy, falls, intervention, older adults, community dwelling. And with that, I found many combinations, anywhere from 310 in my result list to 15, depending upon how I did the search. So 6 that I found ended up being relevant through my numerous search options and trials. So the last one I looked at was CINAHL Plus with full text. Similar things there. I limited my search a variety of ways, same keywords, and I ended up with anywhere from 5 results to 341 results in kind of my search process, and 5 ended up being relevant. So in those, when I found a result that was 341 or 500 and some, that's when I didn't even look through those results. I knew that was automatically too high. I needed to add in another keyword or figure out some of my limiting factors. So then I kind of went back to the drawing board and figured out where to go from there. And that's when I got some of those smaller numbers like the 5 or 2 or 1. And that's when I was really able to determine what fit within my EBP question. Okay, so I wanted to talk about my level 1 search and the 2 main systematic reviews I found that kind of sculpted how I looked at my research, and these were 2 of the main things that I based my themes off of that you'll see in later slides. So the first systematic review I found was by Gillespie et al., and the year was 2012. And this systematic review was titled Interventions for Preventing Falls in Older People Living in the Community. And so this systematic review completed a database search of all relevant information on fall risk interventions for older people living in the community. So perfectly based within my question. It found 51 articles and combined those results to determine what the most appropriate interventions were for reducing fall risk. So I put the 4 main themes I gathered from that article in here for everyone to see. The first was home modification, then exercise, then a multidisciplinary approach, and then I really just added Tai Chi in here to kind of let everyone know that this was something that arose a little bit throughout the literature. It was actually studied quite a bit more separate from exercise, and it's really presenting itself as one of the up-and-coming exercise areas that's really shown to reduce fall risk. So it's still really in the initial stages, but it's really an interesting thing to watch in the future as more research is done on it. All right, so the second systematic review was by Chase et al., and that was in 2013. And it was titled The Systematic Review of the Effect of Home Modification and Fall Prevention Programs and Falls and the Performance of Community Dwelling Older Adults. So, this systematic review also completed a database search of relevant articles and analyzed those results to determine what the most important or most appropriate fall interventions are for older adults. This systematic review looked at 31 randomized controlled trials. And here were some of the main programs, interventions that arose from that. I have home modification, exercise, vision and medication, assistive technology, and multidisciplinary approaches. Okay, so I wanted to briefly discuss my key articles from the level 2 search. And I wanted to kind of preface this by saying that I specifically took more of an occupational therapy based approach to my search for interventions in this level 2 search. Because I was looking at specific studies that had just been, one study at a time or one article, there is so much knowledge on fall risk interventions, it was a bit overwhelming. So in this specific search, I did more of an occupational therapy based approach. I found articles that supported a multifactorial approach to interventions for fall risk at home, some that looked at home safety self-assessment as a specific tool, which I will talk a little bit more about later, and then others that really just looked at environmental assessment and modification, that occupational therapy-based approach to fall risk intervention. Okay, so now we're getting to the more exciting part here. I found 4 main themes throughout all of the literature searches that included the level 1 search with the systematic reviews, as well as just the single studies I looked at. These 4 themes really emerged as important intervention areas and important things to consider when developing your interventions for older people living in the community that are a high fall risk. So the first theme here is exercise, which is really great, especially for the physical therapy friends I have that are watching this. That's one of the main themes that arose that help decrease falls. The second theme was home safety assessment and modification. This is really an occupational therapy based theme that really shows that this was an important piece in the literature that affects, or that's an important intervention for our clients. So the third theme is client-centered education. This arose a lot in making sure the interventions we're doing are really focused on that specific client, their specific environment, their needs, their wants. That's important to make sure they follow through and have those results of decreased falls. And then the last theme was a multidisciplinary, multifactorial approach. The majority of the literature said, we can't just be looking at one area of intervention for these clients. It needs to be a team-based approach. We need to be making sure we're identifying all of the areas that those clients have need, and that within those, we're taking a really multifactorial approach and making sure we're addressing the intervention in an appropriate way. Okay, so the first theme I'll delve into a little bit more is exercise. So this really broke down into 4 areas within the literature. The first was group exercise. The second was individual exercise, so individualized treatment. The third was multi-component exercise. And the fourth was Tai Chi. So the first, group exercise, 2 of the systematic reviews found group exercise to be a very effective method of exercise for older adults. Chase et al. Looked at 7 randomized controlled trials and found a decrease in the number of falls and fall risk in older adults, regardless of what type of exercise was completed. Those 7 randomized controlled trials included either one or combination of functional walking, Tai Chi, balance, flexibility, lower limb strengthening, and gait training. So then a little look at individualized exercise. Systematic review by Chase et al. Again looked at 2 studies specifically geared towards individual exercise, and they found both of those studies were effective in reducing fall risk. Gillespie et al., another systematic review, looked at 7 trials and found that all of those trials reduced fall risk compared to the control group within those trials. So that was also, individualized exercise was also found as an important form of exercise as an intervention. Multi-component exercise, Gillespie et al. Found or looked at 22 studies, and it addressed exercise in multiple categories, and that found statistical significance in fall reduction. And then Chase et al. Looked at 5 studies. 3 of those showed decreased fall risk, and 1 of those showed a decrease in falls. So any of these multiple categories included everything from flexibility to strength-based training to one of the programs, Tai Chi or something like that, but it had to be more than one component within that exercise. So lastly, just a little look at Tai Chi. I touched on this a little bit initially and how it really is a promising new form of exercise that I think much more research is going to be done on the future in. However, in the Gillespie et al. Systematic review, they did look specifically at 6 trials that only addressed Tai Chi, and they found that it significantly reduced the risk of falls. So it's definitely a promising area going forward. Okay, so next I'm going to look at the really occupational therapy based theme that arose, and that was home safety assessment and modification. So one study specifically looked at kind of what practitioner thoughts are on home safety assessment and modification. It was Clemson et al. In 2014, and they did a narrative study that analyzed content and themes, and what they found was that practitioners really did think that this home safety assessment modification was improving their clients, and they were finding it to be significant in helping them reduce falls and to be safe at home. So a different study, or actually a couple studies, looked at this HSSAT, which I have on the right-hand side here. And this is called the Home Safety Self-Assessment Tool. So what this looks at is it's a tool given to older adults. They're supposed to take it home, do it all on their own. It's not an intervention that requires an OT. They fill out a home safety checklist from that, they look at a list of solutions. Also included in that little tool are a list of contact information for them to be able to make the environmental adaptations that are suggested with what they checked off on the checklist and what their recommendations and solutions were within that. So one study done by Tomita et al. Just looked at its reliability and validity and found it to be a reliable, valid tool. A different study done by Horowitz et al. In 2013 looked at, it was just a case study on was this useful for clients, and they found out it was a good tool for seniors, but they did recommend that if seniors had access to an occupational therapist, that would be a better way to go about it. They recommended this tool more so for people who didn't have access to occupational therapy interventions. So, and this went along with another study, different study done by Pighills et al. In 2011, and it really looked at what the importance of an occupational therapist is. You know, if we come up with these interventions, can we have someone else who's not a professional implement them? Does it work that well for people in home care? So what they did was they had trained occupational therapists and they had trained just non-professional people in how to do a home assessment and make these recommendations to clients. But what they found was that OTs were significantly more effective in making appropriate recommendations to reduce fall risk at home. So that was an important outcome there. Going down here to home modifications, this was a little bit of a trickier one because I found that it was not well documented what specific modifications were made or recommended within the literature. And Leland et al. In 2012 touched on this. It was a systematic review, and it found that interventions were not well documented, did not account for financial burdens, and that they were concerned too in some cases home adaptations were paid for, in others they weren't, and you know that financial access to being able to make those modifications to your home really has an impact on your fall risk. So that was one of the things that I think future research will be good for, is really what are these home modifications and were they made? What did they cost? Those sorts of things. So lastly, I really wanted to touch on assistive technology. So unfortunately, this is something that also wasn't very well represented in the literature. And I think it's because it's really an up and coming area for occupational therapy. You know, it's still not very cost effective, unfortunately, at this point. So many people don't have access to the assistive technology things that could help. And then also, I think there's still quite a few studies and research that needs to be done and even products that need to be developed. So I did want to touch on at least one study I found here, and that was by Guittard et al. In 2013. And what they looked at was a smart grab bar. And it was very interesting because the smart grab bar was installed near the bathtub, and it would, when a person went by it, it would sense that and it would give audio and visual cues. So it would light up for them to use it, and it would explain to them exactly how to use it. You know, place your hand on here, step in this way. And what they found was this significantly improved a person's use of the grab bar. So this wasn't a case where it was directly related to falls, but I did want to add something in with assistive technology just because I think that is the future in fall risk prevention. And it did improve the use of the grab bar, which we know to improve falls or to decrease the risk of falls for older people. So that was kind of a key part of the research I just wanted to include. Okay, so next I wanted to talk about client-centered treatment. This came up in so many studies, and I think as occupational therapists, sorry for all my PT, nursing, whoever else is watching this, friends, but you know, from an occupational therapy standpoint, client-centered treatment is very important to us, and it's a lot of what we do. You know, we are making a lot of adaptations, recommendations for clients, and it really has to be within what's most appropriate for them and what they're willing to do in order for them to implement it and follow through with it. So Chase et al. Looked at 3 randomized controlled trials of individualized treatment, and they found that that had a positive impact on frequent fallers. Gillespie et al. analyzed 19 randomized controlled trials and found individualized approach to be statistically significant in fall risk. In decreasing fall risk. So those are really important things to consider. We typically always are client-centered in interventions, any of the disciplines that I work with, but really focusing on what are the client's needs, what are the adaptations we're recommending, what does their home environment look like, will they complete all of these things? You know, that's a really important idea in making sure that people follow through on treatments. Okay, so the last theme I'm going to touch on here is this multidisciplinary, multifactorial approach to treatment. So what I have here in kind of my little graph are some of the things to consider, and those were the things I talked about earlier as well. The four main factors we want to look at: vision, whoever, you know, if that's the nursing that addresses it, probably an ophthalmologist, optometrist, we want to make sure that's addressed. We want to make sure lighting's addressed for vision, various things that will make sure that our clients are able to overcome any vision issues that would potentially cause them to be at risk of falls. The second here is medication, which is typically from a nursing standpoint, but whoever's willing to look at that, you know, the doctor, primary doctor, home care nurses, you know, what are their medications? Are there things that cause dizziness? Are there things that are going to affect them? Those are really important to look at as well. Thirdly, environment. You know, our occupational therapists taking a look at the environment, making recommendations. Physical therapy does a little bit of this as well. You know, if your stairs don't have two handrails, whatever you need, those are things that are really important to focus on. And fourthly, that exercise component. Physical therapists really address that lower limb strength, balance, those kinds of things. So almost, as you can tell here by my in-text citations, Gillespie et al., Chase et al., Clemson et al., Leland et al., Green et al., Weinstein, and Booth all looked at this as an important theme for interventions. So this is really the most important theme that I came up with throughout my research. We need to make sure we're working as a team, all of the client factors are getting addressed, because if we're just looking at their home environment, there's other factors that we're not addressing that could still cause them to fall at home. We really need to make sure that this is a team approach to preventing falls. Okay, so for implications for occupational therapy practice, the first thing really goes along with the last slide, that we really need to ensure we're having a multidisciplinary approach to client care. You know, we need to make sure nursing's involved addressing medications, physical therapy's involved in addressing exercise if need be, and that we're really working together as a team to notice fall risk issues and work them out together. The other main implication was that the research I did solidified my understanding of occupational therapy's role in home safety assessment and modification. So that's something that's really important. We need to continue to be doing, and then especially that modification piece, making sure we're making it affordable any way we can to be able to have our clients do these techniques that are really going to help them decrease fall risks at home. As for future research, I think a lot of research needs to be done more on educational methods. How are we teaching our clients what to do to be safe at home? You know, education up until this point has not really been proven in the literature to be an effective method. So is it because we're doing something wrong here, clients aren't following through, or is there anything that we could be doing to make it more client-centered? That kind of goes along with the client-centered approach here. We want to make sure in the future that research is really geared towards a client's individual factors. And that's where I think it would be really interesting for future research to involve more of the qualitative analysis. So not these randomized controlled trials showing decreased fall risk, but really looking at the qualitative perspective from the client's point of view. Also, a huge area of future research is assistive technology. Everything in that area is changing, new, you know, there's things being developed every day. And so I think that will be an important area to watch for future research. Okay, so here's a list of all my references, quite extensive, and the wonderful research that I found through my level 2 and level 1 research that was pertinent to my topic area. Okay, for acknowledgements, I want to say thank you to Dr. Bass for all her help guiding through this project. Big thank you to Becca Engberg for kind of walking me through this project initially, what we were looking at, fall risk. Interesting to kind of get a physical therapist perspective as well. Emily and Maureen, my classmates, thank you so much for texts and emails and getting through this all together. And a big thank you to my husband Ryan for helping me with our son and helping get me through all of this.